Millions of young people worldwide have mental health conditions. It is estimated that 1 in every 4 people will have developed mental conditions in their lifetime at some point. In Kenya, 20% of adolescent youth suffer from mental health conditions, and it is stipulated that by the time they're 24, 75% of this population will have developed a mental health condition. The Youth Cafe seeks to scale interventions on mental health and promote access to mental health services to youths, which will be made possible by setting up mobile mental health clinics in areas with deprived youths. The project seeks to contribute to Target 3.4 of UN SDG 3 goal, which seeks to promote mental health literacy. If young people in Kenya can access local, affordable mental health clinics with easily accessible counselors through flexible mechanisms like calls, text, or social media, then young people will have an improved capacity for coping with life stresses and an overall higher standard of living. The objectives of these projects are to accelerate access to low-cost and subsidized mental health services, to establish and operationalize mental health literacy programs, thus creating awareness on the subject matter, and to empower youths with personal experiences of mental health problems, to challenge stigma and refer them to appropriate care. We will target youths living with disabilities, young women and girls, youths from low socio-economic status backgrounds, youths dwelling in rural and slum areas, and youths with dual diagnosis, that is mental health conditions and problems with drug usage. At the end of the project, we seek to see impact in the mobile mental health clinics will be available to decrease service barriers, provide flexible field-based services, and expedite responses to user crisis calls. And pop-up events will be coordinated with the healthcare agencies mobile clinic to provide mental health care services and medication administration. We are aware of the many ethical and moral codes of conduct surrounding the health sector, and on this account, the clinic data systems will be encrypted to ensure safety and confidentiality of the participants. No information will be shared to anyone other than the patient and the doctor. The Youth Cafe will take into consideration this and other ethical considerations as per the provisions of the country's health sector. The outcomes of the project are mainstreaming mental health among youths by eradicating the stigma around mental health, discrimination against people with mental health illnesses, creating awareness of the presence of mental health problems in the society, and promoting easy and inexpensive access to mental health services by the youth. How will we know that this project has been a success? 1. Creating a mental health clinic that has 5,000 monthly reach to the youth. 2. At least 20,000 distributed mental health literacy handbooks. And 3. Conducting regular monthly psychosocial engagements with a reach of 10,000 Kenyan youths minimum. To ensure sustainability of the project, we will make use of crowdsourcing platforms after the project time has run out to generate funding to continue the activities of the project. And secondly, we will work hand in hand with medical institutions that are already in place in the country and with the Ministry of Health so that they take up and incorporate the ideas of this project into the systems. The project is going to reach the target audience through advertisement posts in local newspapers, internet, advertisements, and social media ads. Thank you, and for this to be made possible, we will need 100,000 euros for this to be a success. Thank you for